Hi, it's Dr. Janowski for Sonata. Today we're going to do a lip injection, and the technique that I use is what I call a micro-droplet technique, using a 0.3 ml BD insulin syringe, or any brand. And what I like about these is if we backfill the syringe with the product, we can get very precise. We have a very short, very thin 31 gauge needle, and we can do multiple pokes. And despite that, patients really don't feel very much, and there's really not a lot of bruising typically, and we can really get a lot of control. So we've already put some numbing cream on the patient, so slightly open. And so the technique, and come closer, the technique to a good lip injection, especially from the patient point of view, is make it as painless as possible. So if we just use our left hand to distract the tissue, or sometimes push the tissue onto the needle, it goes very rapidly through the dermis, and the patient doesn't feel very much. So we try to just make it as painless as we can. And I'm injecting very tiny boluses, and despite that, it's not going to come out lumpy bumpy. There might be a little bit of that feeling in the beginning, but the product will spread and move around a little bit, and we will get a nice smooth result, both look and feel. And this is Restylane. You can use almost any product in the lip. Go far with that? Okay. And remember the tubercles of the lip, there's 3 on the upper, 1, 2 on the sides, 1 in the middle, and then 2 on the lower lip. So open slightly, and we're going to approach from underneath, feel a little bit there, and we're going to create again a little bolus right where the tubercle should be, and I'm pinching the lip to create that little ball that looks good, and then we compress it with our hand, because we want those 2 prominences to appear, especially in someone who develops a flat lip and there's no contour to it. So we're going to do a little bit more. It's a little pinchy from below, but it reduces the risk of bruising if we do it that way. And again, we're going to go back up here and get the GK points and accentuate the Cupid's bow. She doesn't need a border injection because that would just make it look overdone. So we're not going into the border of the lip. Sometimes that's necessary if the patient has a poor border. We only have a little bit left. And this is a full syringe we will have put in here, and it's still quite modest. Again, a little poke here, a little tiny one here. Good, we're almost done. There should be a taper on that lower lip, so we don't want to put much into the corners of the lower lip, just a little bit here. We're almost done. And then again, we go back to the tubercles of the upper lip. That's it. Okay, that's a full syringe, so it looks great. So let me just wipe her down. Take a look. If you can see, there's very little bleeding, if any. Open just a little bit. And a very natural appearing lip. A little more contour, a little more body to it. And so that's my technique, the micro-droplet technique for lip injection using Restylane. And lips will typically last around 6 months or so. And sometimes people need more than 1 syringe, but most people get away with a single syringe, and we never want to overdo it, make them look silly. That's what patients are really most concerned about. So as you can see, that is not going to happen today. So that's it. Hi, it's Dr. Janowski for Sonata. Today we're going to do one of the more common areas, which is the nasolabial fold, which generally patients will lose volume in this area, and it's one of the first areas they notice, and they come in and say, what can you do about that? So it's often what I call beginner area or first timer, because this is just one of the most common things that we do. I've just added a little bit of local anesthetic at the base of that fold. You don't have to use a cannula here, but if it's fairly mild, a cannula is a great way to treat this area, because then you don't have to do multiple needle pokes, less chance of bruising. If it's more severe or more deep, then you probably have to do either a combination of a cannula and a needle, or needle technique to get it close to sometimes in the dermis, to help that out. But I think she'll get a great result if we just use a cannula. It'll go really quickly. She won't feel very much because we already put the numbing in here. And we just want to soften that fold out. So I have my pilot needle here, and we're going to just place a tiny drop here. We're just going to poke that real fast. Good. And then we'll use our 1.5 inch cannula, and this is a Dermasculpt 1.5 inch 25 gauge. And we can really just follow that fold. We're going to place it. You'll feel a little funny poke here. And then a little funny one up here. There's a little tiny fibrous band there. I want to kind of get through. And we're going to stay fairly superficial here. We're just going to follow that line, and we're going to keep that tip visible by pushing it up towards the dermis, and then we're just going to lay this down here and inject retrograde. So there we go. That one is already done and looking better. We'll do the same thing on the other side, where we just do a tiny little poke here, and then we'll use our cannula once again. This can sometimes make the patient's lip feel numb because we're getting to that infraorbital nerve, and that's fine. And again, we place our cannula fairly superficial. We're going to follow that line, and then there's a little resistance you'll get right up there. We pop through that to help support the ala of the nose, and that's it. That's the whole deal. Okay, let's just wipe you down. Just want to soften it. That looks very good. So that's a very basic injection of the nasolabial folds using a cannula.